We're going to be going through articulator isolations today. These are the muscles that shape speech and sound. They are really important to start including in your speech warm-up because they explore the mobility of the articulators in isolation from one another. When we're exploring these articulator isolations, we are decoupling combinations that usually happen in the vocal tract. And this becomes really important down the line when we start to work on accent and dialect work, because once we develop agility and flexibility of those articulators, we can then make more specific, subtle, and varied speech choices, which is really exciting. I think Dudley writes in the book that the articulator isolations are a lot like learning an instrument, and I totally agree with that. I just have to share this analogy really, really quickly. So about a year ago, I started learning how to play the ukulele, and I was teaching myself, and it was really frustrating at the beginning because my fingers would not go where I wanted them to go. Practicing chord changes was really, really hard because I hadn't isolated the muscles in each of my fingers. So every day I had to do mobility drills, I had to practice scales, I had to practice moving from one chord to the next until I was then able to isolate those muscles in each of my fingers enough to develop the agility and the flexibility to play music with ease. It's the same thing with the articulator isolations. So if you play music, hopefully that analogy resonates with you. One more thing that I wanted to talk about is that I'm going to be modeling these articulator isolations for you. And it's important to note that obviously we all have differences in our muscles of expression in that anatomy and our vocal tract anatomy as well. So as you feel your own way through these isolations, you may see differences on me, and that's totally okay. Use me as a guide as we make our way through these, but then try to focus on your own felt experience. So before we go into our articulator isolations, we're going to start our warm-up with the warm-up. I always like to warm up my muscles of expression first. So we're going to start with a scrunch, a stretch, and a shake of our facial muscles. So let's go ahead and do that. Let's scrunch our facial muscles. And then let's stretch them. And now let's go ahead and shake them with some breath. And maybe even some sound, all right? And let's go ahead and bring some heat into our hands. And then I want you to place the palms of your hands over your orbicularis oculi, your eyes, and then your fingers will be resting on your frontal bone. And just take a moment to breathe into that, to feel the weight of your hands on your orbicularis oculi, your frontal bone. Allow the heat and the weight to soften those muscles and bones. Remember to breathe. And then gently and slowly start to draw your hands down the length of your face. Breathing into all of that. And eventually you're going to hook your thumbs behind your ears here where the ramus of the mandible comes up. You're going to wrap your fingers around the sides of your face. You're going to angle your wrists up a bit. And keeping the jaw released, you're going to draw the thumbs on the underside, along down the underside of the mandible. And you're going to draw your fingers down the side of your face. And you're just going to breathe into that all-purpose jaw release. So hopefully you're feeling a little released before we go into these articulator isolations. So the first one that we're going to start with is we're going to start with the jaw. And I want us first to get a sense of our own jaw structures. So go ahead and take your thumbs and place them on the underside of your chin, your index fingers on top. This is the body of the mandible, the jawbone. And go ahead and feel around its structure a bit. Get to know your mandible, the body of the mandible. And if it's helpful, I encourage you to close your eyes here so you can get more of a sense. You can see, feel the structure of your own jaw. How does it feel? And then as you make your way back along the mandible, you'll notice that there's a part where the jaw starts to curve up. This is the angle of the mandible. And then if we keep moving our fingers up, we are making our way along the ramus of the mandible. And then right here in front of our ears, this is a jaw hinge. This is a really interesting area because this is where the condylar process of the mandible inserts into a depression in the temporal bone. And there's something there between the condylar process and the temporal bone called an articular disc that allows for rotation of the condylar process when we open our jaw and when we advance our jaw. And we can actually feel that at work if you open your jaw gently. and you can feel the rotation of the condylar process. All right. So let's explore our first action. We're going to explore raising and lowering of the jaw. So there are three muscle groups that are involved in that action. The first muscle that we're going to talk about is the masseter. This is our muscle of mastication. It's a really powerful muscle. And the masseter originates at the zygomatic arch at the cheekbones, and it attaches to the angle of the mandible. And we can actually feel the masseter. So if we place our fingers on the side of our face and we gently bite down, you might feel a bulging action against your fingers. That's the masseter at work. And if we start to lower and raise our jaw, we can keep our fingers here. We can feel the masseter. The next muscle that we're going to explore is called the temporalis muscle. This is my favorite jaw muscle because when you look at pictures of it, it fans out like this beautiful conch shell. But the temporalis muscle inserts at the front tip of the ramus of the mandible, and then it fans out. It fans out over the sphenoid bone, the temporal bone, and the parietal bone of the skull. And this is another muscle that we can feel. So if we place our fingertips at our temples, and again, we just really gently bite down, you can feel a more subtle bulging action underneath your fingers here at the temples. That's the temporalis muscle. And then when we raise and lower our jaw and keep our fingers here, again, you can feel that subtle movement. The third muscle that is involved with raising and lowering the jaw are called the medial pterygoid muscles. And these muscles are inserted at the inner mandibular angle. And we can actually feel those in a different way when we raise and lower our jaw. So if you have clean hands and you're not afraid of getting into your mouth, you can take a thumb and sort of hook it behind where your back molar is. And then you're going to place your index finger on top of where your thumb is. And then as you raise and lower your jaw, you can feel those medial pterygoid muscles at work. So let's go ahead and try that. I'm going to start with my left side. And then you can go ahead and try it on your other side. I'm moving over to my right side. So again, those are the medial pterygoid muscles. Our jaw can also advance, it can move forward, and it can also retract. So when we advance the jaw, you want to think about moving the bottom teeth sort of ahead of the front teeth. And I'm going to turn to the side so you can see. And this is an example of when it's important to think about isolating and decoupling, because I think I was just doing this, but sometimes when we advance the jaw, we also raise or lower it. So really think about just advancing. When we advance the jaw, we use the lateral pterygoid muscles, and those muscles are layered on top of the medial pterygoid muscles. They originate at the sphenoid bone, and then they attach at the at the articular disc of the temporomandibular joint. And then we can retract the jaw. So when we retract the jaw, again, if it's helpful, you can think of moving the bottom teeth behind the front teeth. And again, see if you can just isolate that retraction without raising or lowering the jaw. And when we retract the jaw, we are engaging with the temporalis muscle. So again, I think it's just interesting to note when we're able to isolate muscles and when we're able to note when we're coupling that with other muscles. I noticed that my, I think maybe the inner ring of my orbicularis oris was engaged there. So just things to note, and a reminder that this is a process, you know, even practicing these articulator isolations for a long time, we are adept at some of them, and at others they still need work. So we have a whole range of actions that we can work with the jaw. So we can advance it, we can lower it, we can retract it, and we can raise it. So let's go ahead and try that together. And then we can reverse that. We can retract the jaw, we can lower it, we can advance it, and we can raise it. So let's try that. We can also swing the jaw from right to left. And we can explore another circular range of motion with the jaw by swinging the jaw to the right, then lowering it, swing it to the left, and raising it. So let's go ahead and try that together. And then we can reverse that, swing it to the left, lower it, swing it to the right, and raise it. Trying to get my hands away from my face so you can see me. So that was the jaw. We're gonna move on to the cheeks. Let's just take a deep breath. I always have to remind myself when I'm really focused on these articulator isolations to just take a moment To breathe, I find a little bit more flexibility with my articulators when I'm remembering to breathe. So we're gonna move on to the cheeks. So let's start by just blowing some air through our cheeks, thinking about keeping the cheeks soft as we do that. And then we can suck some air in through the cheeks. And we'll only do that a couple of times so we don't pass out. But you'll notice that my cheeks sort of went in here. This is the location of the next muscle that we're going to explore. This is called the buccinator muscle. This is a deep muscle, and it originates at the mandible, and then it inserts at the angle of the mouth. And in order to practice explore full buccinator engagement, we're going to contract the buccinator muscle, and we're going to think about contracting it in towards the teeth. And depending on your facial structure, this might look different on a lot of people. And again, just take note if you're engaging other muscles, really try to isolate the buccinator. And then we can also engage just the front of the buccinator here, right behind the corners of the lips. So that's the buccinator. We're going to move on to the lips. So when we're talking about the lips, we're talking about a muscle called the orbicularis oris. There are two rings in the orbicularis oris. There is an outer ring, and there is an inner ring, which is literally the body of the tongue. Body of the tongue. Wrong muscle. We're not at the tongue, at the tongue yet. We are at the lips, the inner ring of the lips. So we're going to explore just engaging with the outer ring of the orbicularis oris first. So if we think about, again, contracting that muscle and really focusing the effort at the corners of the lips, you'll see that the inner ring of the orbicularis oris starts to protrude. So this is lip corner protrusion or advancement. We can also engage with just the inner ring of the orbicularis oris by pursing our lips. So we're bringing together the bottom lip and the top lip. And then we can engage the outer ring and the inner ring of the orbicularis oris simultaneously through full lip rounding. So we're going to start by contracting the outer ring of the orbicularis oris, tensing that, and then tensing the inner ring of the orbicularis oris. So that's full lip rounding. And then we can go back and forth between full lip rounding and lip corner protrusion, which makes us look like little fishies. We have another muscle that we're going to engage with, and this is called the risorius muscle. The risorius muscle radiates out from the orbicularis oris. So it originates here at the orbicularis oris, and then it goes back and it attaches to the middle of the ramus of the mandible. So when we contract that muscle, It's pulling our lip corners back into this weird smile. And the risorius muscle falls into the cheerful muscle category because when it comes to expression, because we're engaging in this weird smile, we can engage just the right risorius muscle, and we can engage just the left risorius muscle. We can also do something called the aside. So this is engaging one risorius muscle. So for example, your right risorius muscle, and then engaging the outer ring of the orbicularis oris on the other side by protruding your lip corner. So you could try it on one side and then the other. And that one involves a lot of dexterity, and I have not mastered that one, but it's interesting to just kind of practice trying to isolate both of those muscles simultaneously. It's a real challenge. We can go back to just the inner ring of the orbicularis oris and tense that inner ring so much so that the lips curl inward. And then again, we can engage both the inner ring and the outer ring by trumpeting the lips out. This is called extreme lip corner protrusion, where we're contracting those muscles so much that the lips move even farther away from the teeth. We also have the zygomaticus muscles, which are another cheerful muscle. The zygomaticus muscles draw the lip corners up towards the cheekbones so that when we actually really smile at someone, we're engaging the zygomaticus muscles. We have another muscle that falls into the cheerful muscle group. For me, it doesn't quite make sense, but perhaps for you, it will. These muscles are called the levator anguli oris muscles, and they originate at the maxilla, and they pull your lip corners up towards your cheekbones. And then you can practice with just one lip corner, kind of like Elvis. And then you can try the other side. And you'll notice that I don't quite have the flexibility on my left side yet. I was engaging more with my left risorius. So something I need to practice. We also have something called the depressor anguli oris muscles, which pull the lip corners down, and they're attached to the platysma muscles. And then we can engage the platysma muscle in a super frown by pulling the lip corners down even more diagonally. All right, we're going to move on to the tongue. We're going to start by just familiarizing ourselves with the surface of the tongue. And I have my pen. I should have something else, but I forgot my little tongue depressor. So the superficial surface of the tongue. Tip. Blade is right behind the tip, and then behind the blade, we have the body of the tongue, which is divided into front, middle, and back. And then we have the midline of the tongue, which is a depression that goes down the middle of the tongue. And then we have the edges of the tongue, which divides the superior surface of the tongue from the inferior surface of the tongue. With these isolations, we engage the body of the tongue. We also engage intrinsic muscles and extrinsic muscles Intrinsic muscles are more internal. Extrinsic muscles are muscles of the tongue that connect to more skeletal structures. So we're going to engage with an intrinsic muscle first. This is called the genioglossus muscle. It has posterior fibers and anterior fibers. And when we stretch the tongue, when we protrude as far as we comfortably can, thinking about sticking out the tip and the blade, we are engaging with the posterior fibers of the genioglossus muscle. And when we retract the tongue, as I just did, we're engaging with the anterior fibers of the genioglossus muscle. We also have intrinsic muscles called the superior longitudinal muscles and the inferior longitudinal muscles. We engage with the superior longitudinal muscles when we raise up the tongue tip. The superior longitudinal muscles are paired muscles located on either side of the midline of the tongue, and their fibers run from the tip of the tongue to the back. And then we engage with the inferior longitudinal muscles when we curl the tongue tip down. And it's also a paired muscle, like the superior longitudinal muscles, but they're located on the undersurface of the tongue. And then we can engage, for example, the right superior longitudinal muscle and the inferior longitudinal muscle at the same time by curling our tongue tip to the right. And then when we curl our tongue tip to the left, we're engaging our left superior longitudinal muscle and our left inferior longitudinal muscle. And then we can play with all of the longitudinal muscles if we imagine that there is a clock in front of us, and with the tip of your tongue, you have to touch every single number and all of the spaces in between those numbers. Another intrinsic muscle is the verticalis muscle. So the verticalis muscle obviously runs vertically, and this engages with lip spreading. Not lip spreading, I'm sorry, tongue spreading. So you can see that it kind of stretches the sides of the tongue out. We can also do that inside of the oral cavity by bracing the side edges of the tongue against the molars, and we're with that as well engaging the verticalis muscles. And then we have the transverse muscle, which brings the sides of the tongue in towards each other. So I'm going to go from tongue spreading with the verticalis muscle to tongue bunching with the transverse muscle. Now we're going to move to the body of the tongue. I'm going to go a little more quickly through this because I think I'm running out of time. But we're going to focus on arching the tongue, which engages with those inferior longitudinal muscles again. So we can arch the front of the tongue up towards the alveolar palatal area. Sometimes it's helpful for me to think or phonate on an E sound to really feel that front arch. E, E. And then we can arch the back of the tongue up towards the soft palate. And sometimes it's helpful to think, whisper, or phonate on an oo. And then we can do something called moving the mountain. So arching the front of the tongue, arching the middle of the tongue, arching the back of the tongue, and then reversing that. And that's my timer. We can also cup the tongue. So if we want to imagine that there is a marble at the front of the tongue and its weight is depressing the tongue right underneath that alveolar palatal area, we're engaging the superior longitudinal muscles again. And then we can roll that little marble back to the back of the tongue. Imagine it's resting underneath the soft palate. That's the hyoglossus muscle. That is an extrinsic muscle. It pulls the tongue back down towards its attachment to the hyoid bone. So we can think about rolling that marble from the front to the back and then back to the front. And it's really helpful if you have a blueberry for this exercise. I don't have one with me today, but I can usually feel and get more specific with that action if I have something actually on my tongue that I can work with. We can also advance and retract the tongue root. So it sounds similar to stretching the tongue, except when we advance the tongue, we're thinking about advancing from the root, from the back, and keeping the tip and the blade and the body of the tongue relaxed. And when we do that, we're engaging the styloglossus muscle, which is another extrinsic muscle. It points downward from the temporal bone, and then it kind of hooks around to the underside of the tongue. And the last thing that we're going to do is isolating the velum, or the soft palate. So the soft palate has the ability to raise and it has the ability to lower. And the best way to do that is through a yawn. So when you engage in sort of the breathing in part of the yawn, you're raising the soft palate. And when you're releasing that yawn, you're lowering the soft palate. Thank you so much for hanging out with me during these articulator isolations. I hope you learned something today. Thank you.